Welcome back to Wake Up America. I'm Alex Kramer. Well, First Lady Jill Biden has tested positive for COVID. She and the president were together over the weekend, and as of right now, President Biden is still testing negative, just 48 hours away from a trip to India for the G20. Now, does the president still make the trip? So for more on this, let's bring in internist with Custom Care Medical, Dr. Frank Contessessa. Good morning, Dr. Frank. Thank you so much for joining us. Okay, so I just mentioned Dr. Jill Biden has tested positive for COVID. What are the updates on the CDC protocol now if someone tests positive close to you? I mean, she said she's experiencing very mild symptoms. What are your thoughts?
Morning, Alex. Nice to be with you. So, we really have to be in the state of mind where COVID now, we treat it like it's a common cold. What did we do prior to 2020 when you had a cold? You stayed home until you got better, and then you rejoined your life. If you don't want to be around other people, if you're sick and you can transmit it. So what does this? Who really cares what they say anymore? They didn't really help us too much before. So we really have to kind of get past this mentality of testing. And every time you test, you don't test until you test negative, and then you rejoin society. It's just not the way it works anymore. I tell my patients not to even bother testing if they have cold-like symptoms, because I'm not going to treat it any differently if they have a common cold or if they have COVID. It's rest and fluids and stay home until you're better.
I want to talk about just all the different variants. I mean, COVID, just like the flu, it mutates, it changes strains constantly. And we are hearing that there's going to be a new vaccine that will be rolled out. What are your thoughts on everyone going out, getting the new vaccine, keeping boosted?
I am not really encouraging people to pursue this new vaccine. And there's a couple of reasons why. Number one, the strain that they're going to be using for this new updated vaccine, we're already a strain or two past that. It's based on the strain that we were seeing back in January and February, because that's when they start to make this stuff. So we're already a strain or two past it. I don't think it's going to be very useful. Also, the immunity that's conferred by mRNA vaccines, we have found in recent studies, is very short-lived. So you're going to get a booster, say in September or October, and maybe that whatever protection that you might get, which is debatable, will last for a month or two. So I just don't see it. Here we have, Joe Biden, who's had the original series. She's fully boosted, and she still gets sick. So what's the point? I'm seeing very mild cases in general. The illness now has become to the point where it is relatively mild. I haven't really hospitalized anybody for COVID in about 2 years, and that doesn't mean with COVID. And so just keep in mind, when you see the statistics that in the media that the hospitalizations are up, that's with COVID, not necessarily because of COVID. So if you went to the hospital for a heart attack and tested positive in the ER, you're a COVID admission.
Let's also talk mask. I know here in New York City, I've actually been seeing a lot more people wearing masks. And here's actually what Dr. Anthony Fauci had to say. Here's his latest comments on the efficacy of masks. Take a listen.
When you're talking about the effect on the epidemic or the pandemic as a whole, the data are less strong. But when you talk about as an individual basis of someone protecting themselves or protecting themselves from spreading it to others, there's no doubt that there are many studies that show that there is an advantage.
Okay, so Dr. Frank, I mean, I can point to a million different studies that have come out over the past few years about the efficacy of masks. I want to point to the Cochrane database of systemic reviews. They came out and said, quote, wearing masks probably makes little to no difference to the outcome of COVID, whether you wear one or you don't. What are your thoughts when it comes to wearing a mask?
Yeah, Alex, I mean, I don't know what shaped pretzel he has to turn himself into to still convince people of what he's saying. So on one hand, he's saying, the data it's for the population is less than strong. I love this, less than strong, or otherwise weak. There is no data that it did anything at all. And as you mentioned, the Cochrane study, for me, that was the turning point where I think we could point to some really solid data that there was no difference, masks or not. There's another great study out of, I think it was Sweden, where they didn't shut down the schools, they didn't mask, and their numbers were better than ours. There's another study that I've recently seen out of Korea that said not only did they not help, but there's a potential harm with long-term mask wearing, that some of these masks have volatile chemicals in them from the production process, that if you're breathing these chemicals in all day, there could be some serious health risks to wear. We're not intended to be wearing masks for a long period of time. Even in a professional setting, you go into a room and you might wear a mask in a contagious setting. We're not really supposed to be wearing these things all day. So not only do they not work, but they could potentially be harmful as well. I don't think we should be heading back in the mask direction.
Yeah, I mean, I have to agree. And you also think of kids when it comes to them wearing the mask in school, not learning facial features, expressions, and also developing speech impediments as well. Dr. Frank Contessa, thank you so much for joining us this morning. Fantastic conversation.
Thanks, Al.
All right, plenty more still to come right here on Wake Up.